2025, a lot of changes for 2025. If might have to take some action depending on what type of plan you have. If you don't, you're going to get some next year. So let's make sure you're in the best plan for you for 2025. If you're new to my channel, my name is Ed Weir. I'm a former manager of the Social Security Administration. I've taken hundreds of thousands of Medicare claims, retirement claims, disability survivor claims. I've helped millions of people out. So I'm doing this channel. I've got close to 800 videos now on all things Social Security, Medicare, Medicaid, and this is also a live Q&A. So I'm going to help you find the best Medicare plan and know what to look for and what all the pitfalls to avoid. For about, it's going to be a little bit long today, probably about 15-20 minutes. And then I'm going to open it up for questions. So if you have any questions on Medicare or anything, survivor benefits, spouse benefits, disability, retirement, just type them into the chat. I've already got a bunch of questions in there. So let's stop stalling and get right into it. All right, so big changes for 2025. All across the board, Medicare Advantage, particularly Part D, the prescription drug plans, but a bunch of changes there. And because Medicare Advantage plans, most of those come bundled with a Part D, there's a lot of changes on the Medicare Advantage plans. So 2025, you can start enrolling October 15th till December 7th, and then the new plan will take effect January 1st. The brand new plans come out October 1st, so nobody knows 100%. I've seen some of them, so I kind of know, but we can't tell you until October 1st. And one thing that has changed for 2025, there's a bunch of changes, but one thing that hopefully you've noticed, you might see fewer Medicare commercials. You know, last year, well, the last decade, it seems, around the end of the year, all you see is Medicare insurance, you know, football players and starship captains coming on your TV 24 hours a day trying to sell you a Medicare plan. Hopefully that is diminished. One of the reasons, or they've changed their format because the government has come down and said, hey, the way y'all are doing this, you can't do it that way. You can't have an American flag on there. You can't have a Social Security card. You can't pretend like you're Social Security or Medicare. And you can't do the kind of the bait and switch where they say, hey, we've got this great, you know, the grocery card, which they are available. We've got this great grocery card. It'll give you $10,000. I'm just, you know, exaggerating here. $10,000 of groceries and free ice cream and unicorns for life. But it's only in like one zip code in West Virginia. But they advertised it to the entire country, and you call them up and then they tell you, do you live in this one county in West Virginia? No, I don't. And then they give you the hard sell. So hopefully that will stop. They're supposed to stop that type of stuff. But anyway, and then another thing that's hopefully, I'm not too optimistic about this part. Medicare insurance agents are only really supposed to call you if you ask them to call you. Up until now, is basically you click a button on Facebook and you put your number in there and that person calls you. But then if you don't, you know, they don't sell you something, they sell your name to everybody in the country. And then everybody harasses you. That's not supposed to happen anymore. If you tell someone, a Medicare insurance agent or broker, to call you, then that person will call you, and they're not supposed to share your information. So it's a one-on-one. I've completely tired. I've seen the kind of the shady practices for decades in this entire industry. So kicking and screaming, I decided to go ahead and put together my own Medicare insurance broker team that can help you out. If you need help, contact us. I'll put up information in a little bit of how you can contact us and get help. And my people will not call you if you don't specifically tell them, hey, call me on this particular day. They're not going to call you. So there's that. All right. So just kind of a refresher. Medicare Part A and Part B. We don't know what the Part B premium is yet for 2025. When it comes out, when the COLA comes out, the Part B premium, the substantial gainful activity, the annual earnings limit, all that kind of stuff comes out officially. Then I'm going to do a series of videos. I'm going to tell you the details, which you probably know by then, you know, the numbers, but I'm also going to tell you kind of the inside scoop based on my decades of helping people out with all of that and how to make sure you're doing everything right. Okay. So Part A covers the hospitals. Part B covers the doctors. There's a lot of gaps in there. The big one is the Part B gap of 20%. If you have a $100,000 surgery, you have to pay $20,000. That's why people get either a Medicare Advantage plan or a Medicare supplement plan. If you watch my videos, you know that I recommend Medicare supplement plans, the Plan N and the Plan G. No prior authorizations, no networks, but there's a fee for that. There's a monthly premium. A lot of people can't afford that. So over half the people in America go to a Medicare Advantage plan. I just did a video. I've done a bunch of videos on the comparison between the two. If you currently have a Medicare supplement plan for 2025, you don't have to do anything unless you want to, check to see if you can find a cheaper G plan or switch from a G to an N, or your N, you want to switch to a G or find a cheaper plan. Then, give us a call or contact your insurance agent or broker. But in terms of Medicare supplement, you don't really need to do anything on that unless you're looking for a cheaper price. But you also have to have a Part D plan without a prescription drug plan, and you definitely need to review that and make sure. So I'll talk a little bit about the Part D plan as well. And then if you have a Medicare Advantage, those are the ones that are changing. Half of the people, over 51% last I've seen, have a Medicare Advantage plan. And those are, it's the biggest changes for decades on Medicare Advantage plan. You see every single day in the news, this hospital's dropping Medicare Advantage, that hospital's dropping Medicare Advantage, this Medicare Advantage plan is leaving this entire state, leaving this entire region. They're cutting back 10% of the plans. So there's a lot of turmoil for 2025. So if you have a Medicare Advantage, which, again, I recommend a Medicare supplement, but if you have a Medicare Advantage and you can't get a Medicare supplement, then that's fine. You just have to find the best one for you. It takes a little bit more effort, about an hour a year. So not too much effort. And if you don't want to do it yourself, just, reach out to an insurance broker or agent that can help you out. And what is the difference between a broker and agent? So here's what first thing I caution you. If you call somebody or somebody calls you because you told them to call you, and first thing you ask them and says, are you an agent or broker? Sometimes they use that interchangeably. What I'm getting at is, does that person only represent one company? So if that person represents XYZ Medicare insurance agency or health insurance company, then that's the only one they're going to recommend. So you want a broker, one that represents many in your particular area. There's not many agents that represent all in your particular area, because some of them, they're like, oh yeah, I'm not going to get contracted with that company because they're terrible. So they might, do, 5 out of the 6 or 6 out of the 7, but maybe not that last one because it's, there's no good plans there. So always ask them, do you represent many companies in my area or just one? And that's how you're talking to a broker, and a broker doesn't work for the insurance company. They work for you. They are just contracted with the insurance company, several insurance companies. So it doesn't matter whether you pick A, B, C, or D, they are working for you. So they try to pick the best plan for you. All right. The first thing you need to do is, when you're looking for a plan out there, is coverage. Does it cover your treatments? Does it cover your prescriptions? Prior authorization. Is the company that you're looking at do a lot of, prior authorizations more than other companies? One way you can look at it is they've got star ratings. So you can check out the star ratings for those particular companies. On the prescriptions, you see the formulary for the particular company. If you got 2 companies that look like they're about the same, or 2 plans. And that's another thing too, is if you have XYZ Medicare insurance company and you're like, I really like that. They have 0 premium. They have my doctor. I like the company. I've had it for a year or 2 years. Well, you've only had it for, a year, because they renew automatically. So your plan last year is no longer your plan last year. It's a new plan. But that company probably has 5, 6, 7, 8 different plans in your particular area, and they upgrade those plans every year, but they don't upgrade yours. They make a new plan and they upgrade that one. And then they take your plan often and they downgrade it in terms of charging you more for, a specialist, or if you go to the hospital for an MRI, a CAT scan, or whatever the case may be. And that extra money they're making off of you, they give it to the new people that enroll, that they entice to enroll. So that's why it's important to check your plan on a yearly basis, because, you just might have been downgraded to cover new people coming into the program. Another thing, probably the number one thing, if you get a call from one of my people, if you want one of my people to call you, the number one thing they will do is say, tell me your doctors. That's the most important thing. What doctors do you want to continue seeing next year? Not that, what doctors did you see 5 years or something, like you're filing for disability. No, what doctors are you going to continue seeing next year? And then they will look for a plan that covers those doctors. So they go, oh, there's 6 plans in your particular area. 2 of them are with this company, 3 of them with this other company. Okay, now let's go for number 2. Got your doctors, like, what are your prescriptions? Okay, let's see which plan has the best for your prescriptions, the tier, the deductibles, the formulary. Okay, out of those 5 plans, here's the best 2. Okay, what are you looking for now? Do you need more dental? Do you need more vision? Does it look like do you need the less cost? Do it look like you might have a surgery next year? We want to save you some money on a hospital stay. So this one's got $500 a month hospital stay. This one's got $100. Okay, this looks like the winner. And then they say, this one looks like the best for you for this reason. And then you say, oh, okay, that sounds like a good one. And they go ahead and enroll you, and everything starts January 1. And next year, if things change, you do the same thing again. You say, okay, well, yeah, it looks like I was going to have a surgery, so I was looking for one for the cheapest hospital, but now I need some dental, so let's switch it to a plan that has more dental. And then you get your dental done, and then you switch back to another plan. Remember, all this money is yours. These companies are not giving you this stuff because they're, super awesome, altruistic. All that money you paid into FICA, all those decades, that company has that money. When you enroll in that company's plan, that company, they go to Washington and say, hey, we just enrolled Carol, give us Carol's money. So the government gives Carol's money to the insurance company, and it's Carol's job to make sure she gets as much as that money back as possible, because that's her money. So get it back in terms of dental, get it back in terms of, saving your money for, insurance, for hospital stays. All of that money is your money. So network, that is the most important thing. And then obviously, again, the dental, vision, hearing, gym, food cards. Yes, those food cards, they do exist. People that have Medicare and Medicaid, those are the plans that traditionally have the best extra benefits, because Medicaid and Medicare, and then you got there's all kinds of different programs paying for that. But they do exist. The way they're advertised is not good, if you ask me. But they do exist, and hopefully the industry will get in there and start policing, and some of these agents and brokers will lose their license if they start harassing people when they're not supposed to, and not looking up their doctors and all the rest of it. So it's important that we keep these people on their toes and make sure they're doing everything they're supposed to. And if you need help, here's you can click on that, and I've got a category there where it says, hey, I'm good now, but put me on your list for October. And then when the new plans come out in October here, which is very, very close, we'll send you a link, and you can pick a particular time and a date to review your plan, and we'll have one of our people call you up, and it should take about an hour or so, and they'll ask you for your doctors and your prescriptions and what else do you need, and they'll find the best plan for you, make you 1 or 2 or 3 recommendations. And if you like it, then they'll help you enroll. If your plan is the best plan for 2025, then you don't have to do anything. It automatically restarts. Your current plan ceases to exist December 31st, and the new plan starts January 1st. With the same company, you'll have the same card probably, unless they decide to send you another card or something. But everything it continues if you do nothing. And all of the changes, you should have already been notified. You should have already received the letter. It's called the ANOC, the Annual Notice of Change. You should have already received that from your health insurance company, going over all the details, all the gory details for next year. Again, just don't look at, okay, I've liked it up until now for the last few years. Next year is a completely different plan. So your past experience has no relevance to whatsoever to January 1st. You're like, oh, this plan has treated me well up until now. Well, that's up until now. December 31st, that plan is gone. You're getting a new plan January 1st. Again, it's technically your current plan, but they change everything under the hood. They can change everything under the hood. So you have the same card, the same company, but they change all of the details, and people don't know until something happens. And then unfortunately it's too late to switch again in many circumstances. There are special circumstances where you can switch. Okay, all right. So if you got any other questions on any of that, make sure you type it in the chat. Let's go ahead and move to a live Q&A. I already got tons of questions here. And I've got a good one here from Kathy. She had a phone interview that she's going to be retiring her surviving spouse benefits. So probably she's going to go ahead and get her surviving spouse benefits and then hold off on her own, let her own increase until she's full retirement age or 70 and ever gets more. So switch over onto her own. But she took her documents down there, and let's give a shout out to good customer service when I see it. Alexander City, Alabama, Social Security office in Alexander City, Alabama treated her well, almost no wait. So awesome, awesome. Yeah, that's great, awesome, Alexander City, Alabama. But unfortunately, that's one of the bad things. There should be some kind of workload mobility, where you've got other offices where there's a 6-hour wait. So what Social Security should do is move that workload around. Alexander City sounds like their staffing is okay, so they need to help other offices. Alexander City, great job, but please volunteer to help other offices. So we need some workload mobility. My office helped other offices throughout the country do stuff, and we helped them improve customer service and all the rest of it. So it's a team. Social Security, it's a team. My question is, I was enrolled in, I tried to avoid the names, a Medicare Advantage plan now. Previously, I had Medicare, GEHA, Federal Employees Health Benefits from my husband. Which is better for me? Please advise. Again, nobody can tell you. That's one of the traps is, oh, my next door neighbor has X, Y, and Z company, so they really like it, so I'll go ahead and enroll in that. No. Unless it's like a Medicare supplement plan, which they're all the same, N or a G, but that's a budget issue. Your next door neighbor could have a lot of money and you don't, or health issues. But in terms of your next door neighbor has this plan and they really like it, so you go ahead and get that plan based on the recommendation. No, that's not a good way to do it. Without checking all the doctors and the prescriptions and all the rest of it. If that plan has the doctors and your prescriptions and all the other things that you need, then yeah, a recommendation, yes, obviously helps. But don't pick that plan specifically, on the sole, recommendation of your next door neighbor. If we can't afford the supplement, what is the next best plan? If you can't afford the Medicare supplement plan N, plan G, there's also a high deductible plan N and plan G that the monthly is cheaper, but if something happens, then you have to pay that high deductible. So I'm not a big fan of high deductible Medicare supplement N or Gs. Yeah, the next best plan is a Medicare Advantage that you spend an hour every year with someone that can help you out, that you know and trust, that can make sure you're in the best plan for the following year. Yeah, Medicare Advantage, I wish there was, I wish the entire thing was completely different. I wish there were no gaps in Part A and Part B. You paid FICA taxes all those decades. Why are there gaps? Well, there's gaps in there so health insurance companies can make money. So anyway, so I wish there were no gaps. You had Part A, Part B, and that's it. You're done. You didn't need Medicare supplement. You don't need Medicare Advantage. You don't need, but that's not reality. I wish it was, but it's not. So Medicare Advantage is your best option in this particular case, and you just have to make sure you're picking the best plan every year. So that's it. All right. SSDI canceled my exam. So cancel your exam. So we're talking a consultative exam for an initial decision or something. Basically, what Mully is talking about is when you file for Social Security disability benefits, they check your medical records, but if there's not enough there, or for whatever reason, they ask you to go see a Social Security doctor. So that's called a consultative exam. Or maybe you're in the CDR process, continuing disability review process. So if they canceled your exam, then not sure, maybe the doctor got sick or double booked, or they found other documentation where they didn't need you to go see a Social Security doctor. So just just roll with it. So there's my number. If you want my team to reach out to you, again, they're not going to call you if you don't tell them to call you. They don't do that. Call the number, the 888 number, press 1, leave a message if they're not available, or email me and say, hey Ed, I need help picking the right plan for me for 2025. Here's my name, here's my phone number, and here's my state, because all these plans are state specific, and Medicare Advantage plans are actually area specific. I've got people that are on one side of the stream, one side of the street or street that have one Medicare Advantage plan, and their neighbor across the street can't get that one because it's a different jurisdiction, different district. So it's all based on your zip code. Dave, friend disabled on SSI. What do they do when he gets the RV money? Does he call and cancel disability? Yeah, if he gets any type of money and he's on SSI, that is truly SSI, the supplemental security income, then any type of money coming in, it's not going to cancel the disability because of money. But if he gets X amount of money, because SSI is a welfare-based program, low income and resources, he or she just might have to spend that money down or not get benefits for those amount of months. And so yeah, if get that money coming in and say, well, but I need that money to buy a new car, or I need that money to do this, and I have an operation coming up, I need to do whatever, and then you just talk to the Social Security SSI CS, the Title 16 CS. Title 16 is Title 16 of the Social Security Act. Those are supplemental security income specialists at your local Social Security office. And you just say, hey, I'm getting X amount of money, but here's my intention of doing X, Y, or Z with it, and they'll do the right thing. Because when that person signed up for SSI, they signed a statement that said Social Security could go in there and check your bank records and all that kind of stuff. So they find out. So it's good to go ahead and be preemptive. I have veterans medical care. Should I get Medicare? That's a one-on-one decision. In medical veterans care, you mean TRICARE for life? If so, then yeah, they require you to sign up for Part A, Part B. If you're talking, you're not retired, like I'm not retired. I'm 8 years in the Marine Corps. It seems like 20 years, but I don't get TRICARE. VA medical. I could have gotten that, but not anymore. But yeah, if you're getting VA medical, and you're happy with it, and you're never gonna, you don't want to pay the Part B premium, but there are options. What a lot of people do that get VA medical, that uses a VA system predominantly, they get what's called a Medicare Advantage only plan. It doesn't come with prescription drugs. Veterans prescription drugs are so much better because the Veterans Administration can negotiate prices. So they negotiate good prices. For Medicare, just recently is able to negotiate prices because pharmaceutical companies own Congress, and so there's that. But yeah, you can get a Medicare Advantage only plan, and some of those actually pay for your Part B, so you can kind of have your cake and eat it too. You can have Part A, Part B. You can get a Medicare Advantage plan that pays all or part of your Part A or all of your Part B, and then you can get all the extra benefits, maybe a food card or stuff like that. So you can have all of it. So yeah, if you want to check it out, see all your options, see what's available, if those plans are available in your area. I don't want to do like that football player says, hey, they're all available. No, generally the Part B give back plan, those are available nationwide, but whether they're really good in your area, that's a whole different thing. So I want to make sure in your area, except in Nebraska, you'll be billed later. Anyway, they have them in Nebraska too. That's an old joke. Not a very funny one, but anyway. All right, so let's see. Okay, SSDI canceled my exam in this normal. Do you think they made a decision? Should I contact them? It's been 9 months. Okay, so this is a new initial claim. Yeah, if they canceled, I wouldn't take that as definitive proof of one way or the other. You don't know. They could have, I've seen them, I've taken hundreds of thousands of disability claims, and I've seen them cancel them for, the doctor's not there that day and they can't find another doctor in time and they've got enough evidence to prove your disability, then it is what it is. Or they don't need to see the doctor because they've got enough evidence to prove that you're not disabled. So yeah, I wouldn't speculate. I wouldn't, beat your head up against the wall trying to, foresee what the bureaucracy is going to do. Can I file for SSDI back pay 2021 for my minor children who is now 20, and for those of us who are lost in the sauce? Yeah, so you can always request back pay if your minor child is what spouse is talking about here is DAC benefits, disabled adult child benefits. So the child was approved for disability based on a disability that started before the age of 22, and they're getting benefits on the parent's record. The parent is either receiving retirement or disability benefits, and so they started the child's benefits, but spouse is the name of the person here, thinks that they should have started the benefits earlier. Yes, 100%. You can request a reconsideration. It's a SSA 561. Request a reconsideration that says, yeah, thank you for starting the disability, but it should have started a year or 2 years early. However, caution, that means they're reopening the case and someone else is looking at it, a completely different person than made the initial medical decision. So another person is looking at it. So there is a chance that they could say, oh, why was this person even approved in the first place? And yeah, so just a cautionary tale there. Maria, my income for 2008 is wrong, 50K too low. Social Security will not correct. I've jumped through all the hoops. Yeah, there is kind of a statute of limitations on some of that, 3 years, 3 months, and 3 days. If you've got the proof, so if it's in the suspense file, and the suspense file is the Social Security's file that has billions of dollars of money in there going back to 1935 that hasn't been allocated to a particular worker. And usually it's just somebody had, along the way typed in the wrong Social Security number, 1-2 instead of 2-1. If the money can be found in the suspense file, then it's easy to go ahead and do it. It involves a 2.8 Medicaid. You don't need to know the sausage, but that's how internally they do it. And they just take that money out of the suspense file and stick it on your record, do the recalculation, and it increases your benefits possibly. But yeah, if they're not doing it, I'm not sure why they're not doing it in the sense of because it's beyond, there's a limit of time. It's beyond that time. And that's why almost every time I do one of these live Q&As, which I've been doing pretty much every day for months now, that I always tell people to check their earnings record, because you don't want to get in a situation like this where you lose money for the rest of your life. So in your particular case, did they give you an official decision that they're not going to do it, or was just someone at the front window saying, I'm not going to do it? That's not an official decision. That means nothing. So you can request a reconsideration to a SSA 561 and then submit that, or you can contact your local federal congressperson, senator, and they've got a button on their website that says, I need help with a federal agency, and that becomes a congressional issue. And usually, the Social Security will have to jump through those hoops. So Leslie, signing up for my Social Security. My wife and I are retired. I'm 69. We are both on Medicare. She has a group health insurance, but when I enter her retirement date on the form, it gives me an error. Yeah, not exactly sure why. So if she has health insurance from current work and you have health insurance from her current work, then you don't have to sign up for Medicare Part B. If you're happy with that plan from work and the employer plan has 20 or more employees, then you don't have to sign up for Part B. You can wait until you're 70, 80 years old, and then when you stop working, then you sign up for Part B. Save yourself that money all that way, all that time. There's no penalty whatsoever. But yeah, I'm not sure what error it shows. Um, but if you're 69 and your health insurance is going to stop, then you have to provide a couple of forms, the 40B and the 564. One of those you take down to her employer, and your employer certifies, yes, they have had health insurance from current work since they turned 65. Don't, don't penalize them. Just an FYI, Advantage plans do not send to supplement plans or Medicaid. It's hurting the doctors and hospitals. Medicare plans do not send to supplement plans or Medicaid. Not exactly sure what that means. Send to supplement plans. Medicare Advantage do not send to Medicare Supplement Plan G or N or Medicaid. Yeah, not sure. Yeah, there's a lot of doctors and hospitals dropping Medicare Advantage plans because of the delay of people getting payments and the low amounts these doctors and hospitals are being paid. There's actually one of the big um, Medicare insurance companies in the country also make an incredible amount of money loaning doctors money because they pay these doctors so small a reimbursement that these doctors are having a hard time paying the rent and their staff and stuff like that. So the company says, hey, yeah, we paid you crap, but we're here to rescue you. We'll loan you some money at, you know, interest. So they make money. Yeah, the whole thing, the whole system is anyway. So how many years does Social Security go back to figure your Social Security retirement? All the way from day one. If you were a child actor at 2 years old and you paid into Social Security, it goes back to you when you were 2 years old. So it's based on your high 35 years of earnings. So whatever your high 35 years is, that's how far they go back. By the way, is my GIHA government federal health employees called a supplement plan? No, it's just called, it's just a supplement plan it is kind of a supplement plan, but what Medigap, Medicare supplement, same thing. Those are the plan N and the plan G. Do I need to pay for the 174 for Medicare? If you're on the federal employees health benefits, they don't mandate you to get Part B. So it's your decision. Some people get it, some people don't. Some people get it and get one of those, Part B give back plans so they can get some extra dental and gym membership and stuff like that. At what age can you get N or G at a lower cost? At 65. That's the best price at 65 for those. People that are receiving Medicare because of a disability, if you're 55 years old and receive Medicare because of disability, unfortunately, your state probably doesn't mandate health insurance companies to give you one. And if they do it, they're crazy expensive. So that changes when you turn 65. So when you turn 65, that's when you get the best prices for N and G, N or G. Lori, so I pulled the trigger and submitted my app to Social Security. I received a nice email stating my claim is being handled in Chicago. So hopefully in your experience, they are high on your list of good ones. Yeah, that's probably the Chicago Processing Center regional office. So it's probably not your local office. So your local office is just inundated and they can't do it. So they outsource it to the local processing center in Chicago there. So that happens all the time. There's 9 regional offices throughout the country that do that. So yeah, if everything is good on yours, you checked your earnings record and you made sure you're not entitled to any other benefits, survivor benefits, spouse benefits, and stuff like that, it's pretty easy. If you ever served in the military, make sure you include your DD-214 in those times. I've taken hundreds of thousands of retirement claims, and if they're simple ones like that, no strange missing earnings or the claim is adjudicated in 3.5 minutes. Pretty easy. Takes about 20 minutes to take the claim, and as soon as the person walks out of the building, push the button, claims adjudicated, checks on the way. Good evening from North Carolina. Hey, Craig, my XXX Plan G agent said they won't have Plan G in 2025. Is Plan G going away too? I've heard people talk about that. I have no idea where that came from. Yeah, no, Plan G is the government, that's in all 50 states. You can get, well, Massachusetts is a little bit different. There's another state, I think Minnesota is a little bit different, but they have kind of G and N lookalikes. But yeah, no, G plan, N plan, they're not going away. The F plan, you can't get into those anymore unless you're very elderly. And you probably wouldn't want it anyway, because the prices are really, really going up on those. But yeah, you're the like sixth or seventh person I've heard said that. So I don't know if this is where you have a G and they're calling you up and say, "Oh, that's going away anyway, so you have to switch so they can make money." I have no idea why they're doing that. That doesn't sound, yeah, legit at all. Yeah, that's I don't know what's going on out there. So your that particular company may no longer offer a G in your area, so you just get another G from another company. But I know that company, and that's one of my favorites, because I always liked Marlon Perkins, The Wild Kingdom. I love that show. And they're an awesome company. So, all right, sorry, I gave an endorsement, kind of, sort of, on a TV show. Not anyway, but I like that company anyway. So, but there's that. How many months before one plans to enroll in Medicare should they start the process? About 2 or 3 months is fine. Does it matter if it's online, phone, or in person? Thanks for all your help. Nope, doesn't. Either way is fine. I always like speaking to a human being, so call and schedule an appointment, like a phone appointment. I don't like going down to the local Social Security office. So yeah, you can call and do a phone appointment 2 or 3 months before, but that's for the Medicare Part A and Part B. Months before that, you should start figuring out what you want to do for the more complicated stuff. Part A and Part B is easy. You sign up, you're done. All the other stuff, that's what takes the research. Do you want a Medicare supplement? If you want a Medicare supplement, do you want an N or a G? Which company? If you have to get a Part D plan, a prescription drug plan. Do you also want a dental vision plan, or do you want to go a Medicare Advantage plan? And what are your priorities there? Who are the doctors? Yeah, so there's tons of decisions you have to do on all the other stuff. Sweet pea, thank you for helping us. You're welcome. Do you know why Medicare correspondences, approvals, and cards, et cetera, coming from a different state from where I live? I'm in Georgia and surprised it wasn't Atlanta instead of it was other Chicago. Yeah, that's normal. Again, they outsource. When you sign up for Medicare um, through Social Security, then Medicare prints the cards and everything like that, and they send it from a national processing center, and so yeah, that's not an issue. If I haven't received a letter from Medicare, what should I do? Letter in terms of what kind of letter? We talk about the annual notice of change from your Medicare company. Yeah, most of those should have gone out by now. If you haven't, then maybe in the next few days, you'll receive it. But yeah, you should get that every year. And next year, one of the changes for next year is they're going to do a mid-year letter, which is great. I think this is a good idea. The government said, okay, Medicare insurance companies, Medicare Advantage insurance companies, we are giving you X amount of money. And part of that X amount of money that we're giving you from Kim Jones and Sweet Pea and CE and J-Lo and all those, you're telling these people that you're giving them extra dental and gym membership and vision and all that kind of stuff. But we notice these people aren't using this. What's going on? Are you not making them aware that it's available to them? Are you making it difficult for them to get that extra dental and vision? Are the plans so terrible? Oh yeah, we'll give you $4,000, but you can only use this one Edward Scissorhands at the end of the block. Anyway, so starting next year in mid-year, the insurance companies have to send you a letter that says, hey, by the way, you've got $4,000 or $1,000 of a dental, you have a grocery card, you have X, Y, and Z. We notice you haven't used it. We're just letting you know that and that's another reason health insurance companies are cutting everything back, because they're like, oh my gosh, we're going to, have to actually start giving these people dental and vision and all this kind of stuff, and actually have to pay for this stuff now. So because people are actually going to use it. And the CEO needs a new yacht, and need to go to Monaco and all that kind of good stuff. So yeah, if you haven't received, if you're talking about the annual notice of change, that's fine-ish. Reach out to your Medicare broker. and they can just look it up in the system starting October 1st. They can look it up in the system and see exactly the details of your particular plan. And if you ask them to, then they will look at all the other plans available in your area and say whether you're in the best plan. And again, if you need help, click on that button, email, call, and all that good stuff. And I can have one of my people give you a call and go over everything. Completely free, of course. Hey, J-Lo, if applying for ex-spouse death benefits, is there an income limit amount if I'm planning to work to make up 0 years? Should I have been notified by Social Security? Should I make an appointment? For surviving spouse benefits, divorce surviving spouse benefits, yes. If you're looking at, you know, in terms of getting those early before your full retirement age, yes, there is a limit. This year it's $22,320. $1 for every $2 you go over will be withheld. So it sounds like J-Lo is doing the smart thing. So she's going to go ahead and get surviving spouse benefits, get that money, and she's going to continue work, hopefully, you know, to the limit there, and then continue to pay into her own Social Security amount. And so that will increase her Social Security amount, plus waiting to your full retirement age increases your own Social Security amount, and actually waiting till after your full retirement age, all the way to your turn the month you turn 70, you get those delayed retirement credits, 8% every year. So sounds like she is doing the right thing there. Yeah, so you can work and pay into it, increase your benefit, but you have to stay under the 22,320. That's this year. Next year, we don't know what the new numbers are for next year, but once they come out, I will. You'll probably, again, you already know the numbers. Everybody and their mother are going to announce the numbers, but I'm going to tell you what those numbers mean, and based on an insider's perspective, and how to stay out of trouble, not get those nasty grams from Social Security. Yeah, all those nasty grams that went out from Social Security in my office had my name on it. So people, yeah, it's like, it wasn't me, it was the computer that generated these letters. I was the manager, so my name went on it. So sorry, yeah. So, but I can tell you how to prevent that. I'm sorry for all those people that got nasty letters from me. It wasn't from me, it was computer generated. But anyway, what percentage is my Social Security benefits reduced? I'm collecting my late ex-spouse benefits due to a disability. I'm collecting my late ex-spouse benefits. So you're getting disabled widow's benefits. So disabled widow benefits is 71.5% of your deceased spouse's PIA, the primary insurance amount. Will I receive the full amount when I myself am full retirement age? I am currently 65. No. If you are receiving disabled widow's benefits, that means you began your disabled widow benefits between 50 and 60, and you're locked in at the 71.5%. When you hit your full retirement age, 66, 67, or whatever the case may be, then you're switched from regular disability to surviving spouse benefits, but the benefit check stays the same. So you won't even notice the difference, you know, the change. But at that time, if I would definitely check to see if your benefits on your own record have increased, because they have increased, you know, every month you delay. So call up Social Security and find out how much benefits are on your own record for when you hit your full retirement age. So maybe you want to switch over to your own at your full retirement age, or 70 years old. Let's see. I'm paying to federal employees' health benefits for my deceased husband, previous work, and pay Medicare. Do I still need Medicare Advantage? Again, some people get those, some people don't. It really depends on, you know, if you want your Part B paid, you want the extra benefits. Tests, yes. Hey, we're sure to hit that like button. Yes, that helps out. This crazy algorithm and all this stuff, that's how the computer AI decides this needs to go out to more people. You know, cat videos are great, but I think this information is more important. It helps people. I need to decide now before the 1st if I'm going to stay with Medicaid Texas Star Plus Superior Plan, or yes. So you definitely need to check out all your options. So if you have Medicaid and Medicare, so you're dual eligible, Medicare and Medicaid, you can't have both. And hopefully Medicaid is paying for your Part B premium. So you don't have to pay that $174 out of your pocket. And then you're eligible for, it sounds like you're eligible for Medicare Advantage dual eligible plan. And the dual eligible means you're dual eligible Medicare and Medicaid. And those are the ones with all the extra benefits. Those are the really good grocery cards, again, depending on your particular area, and the extra dental and all those kind of stuff. So yeah, if you want help, you reach out to someone in your area that you know and trust, or give us a call. All right. Let's see. I have two questions. Number one, I saw an article yesterday that cola will be 2.5%. Yeah, nobody knows. Yeah, it's the same news organization. I think it's some AI generated that just prints out these articles so you click on it. It's all clickbait. Nobody knows what the cola will be until the first week of October. So nobody knows. Number two, I'm 64 and applied for my Social Security. I don't have health insurance, but I will apply for Medicare in October. Do I have to go online and apply since I don't have insurance? Okay, good question. Thank you for. I think this was part of a previous question that I failed to answer. So if that person is still around, sorry, I think I missed part of your question, but this answers that. If you are currently receiving Social Security money benefits on a monthly basis, and then you're about to turn 65, you don't have to do anything. Medicare will sign you up for Medicare Part A and Part B automatically, so you don't have to do anything. If you don't want Part B at that time because you have health insurance from work, your spouse's work, and 20 more employees and all that kind of good stuff, then you just refuse Part B. You have to keep Part A, that's zero premium anyway. You refuse Part B. But if you're not receiving Social Security money benefits every month, then you do have to sign up for Medicare. And you sign up for Medicare Part A, Part B, or just A, whatever the case may be, about 2 or 3 months before you hit 65. So again, if you're receiving benefits, automatic. If you're not, you actually have to file. When the time to retire comes, will I be able to collect my retirement plus Social Security? Yeah, if you're, any type of other private retirement, Social Security, want you to do that. That's part of the original thing back to 1935, 3 legs of the stool: your retirement plan, your savings, and Social Security. Unfortunately, retirement, those defined pension plans are, kind of the way of the dodo bird. But if your retirement is from a non-covered pension, that means you work for a state, local, city government that did not pay into Social Security, that's going to affect your Social Security benefits. So could you please send brokers for Medicare plans that will work for me? Yeah, just click on that little thing there and a little form pops up. You fill out your name and you click the little button that says, I'm good now, but put me on your list for October. And then when October comes and we start getting the schedule all figured out here, because you can't do anything until October 15th anyway. So we've still got some time. But yeah, we're getting tons of people that need help. And because this is going to be a crazy year, and I hate surprises, and I know you hate surprises January 1st. Or if you can't click on that, just email me at ed@mygovexpert.com and say, hey, Ed, I was at your live today. Put me on your list for October. Here's my name. Here's my phone number. Here's my state. So we can definitely help you out. Took a regular here that's helped so many people get so much money by liking and sharing. So awesome part of the community. Let's see. Had Medicare Plus, great retiree, blue, traditional for years, old employer change traditional to Advantage. Yeah, a lot of private insurance companies, you retire and they say, hey, we're going to continue your health insurance when your retirement's going to be awesome, just like you were when you were working. It's awesome. And then they're switching it to Medicare Advantage plan because that saves company money. And then you have to deal with the prior authorizations and the networks that are diminishing and declining. And yeah, so the CEO and the board of directors get their yacht, but you get, yeah, but some of those plans are good. the retiree Medicare Advantage plan, sometimes the retiree, the company pays for part of it and they negotiate a really good one. So some of those are actually pretty good, but whether they're going to stay good in the future, because they've already downgraded from your regular, health insurance retiree, they downgraded it essentially to Medicare Advantage, a very good Medicare Advantage possibly. So that's an indication that maybe next year, 2 years, 3 or 5 years from now, they might downgrade it again to a less awesome Medicare Advantage plan. So, yeah. I have Medicare, don't have Advantage plan. Yeah, so that means you have just a regular Part A and Part B. You've kept that, and hopefully, unless you got a few $1,000,000 sitting around at the bank, hopefully you got a Medicare supplement plan, one of the N or the Gs. Unless you got a whole bunch of money in the bank, and then if you do, make sure you click on the little thing and buy me a coffee or beer. Mr. Tiger Singh, I think it's for Tiger, right? It means Advantage plans don't send the 20% or co-payment to Medigap plans. Yeah, you cannot get a Medicare Advantage and a Medicare supplement plan. So yes, you cannot. Yeah, it's impossible to have both. It's illegal to have both. How do I know if my Medicare Advantage plan has been canceled? I'm in Arizona, Maricopa County. Yeah, you should receive a letter from your company. Like I said, there's one or two of the big ones that everybody knows the name. They have already said, oops, we signed too many people up in areas that are not making us money. Maricopa County is pretty good. That's a giant county. You've got Mesa and Phoenix and Glendale. So they've, you've got Maricopa County is probably good. Your plan hasn't been canceled, but probably a whole bunch in like Pima County and other places around you out in the desert, I'm sure they're going to get some cancellation notices because the insurance companies say, well, out in the middle of the desert or out in the country, these, plans are not making that much money. So we're just going to focus on the big cities. That's where the money is. So the people out in the country are, unfortunately, yeah, it's going to be rough. That's why you have to review your plan coming up. Let's see. I get help for my Part B premium because my monthly income is below $1,500. I'm on SSDI. I have some savings in the bank. What is the limit I can have for assets to be eligible? For SSDI, assets don't matter, but you're getting Medicaid from the state. So each state does a little bit different. Medicaid is the health insurance program. It's funded by state and federal benefits or money. It's kind of a cooperation between state and federal, but the federal government allows the states to do different things. So it really depends on your particular state. So I would reach out to your particular state and find out how much the resource limit is. And if you're going over, then you say, okay, but I'm using this money. I'm about to use this money to get a new car or something for your disability or something, and it's called a spin down. So they might have you set it up. Will U.S. residents green card keep their Social Security pay if retiring abroad after decades of paying to Social Security? Yes, it depends. If you paid into it, it depends on your particular area, where you're going in the world. North Korea or Cuba, sorry, no go. But I'm going to go ahead and copy here and paste overseas. So I'm going to put a little note in the chat down here and click that little link, and it gives you to a payments abroad screening tool. So it'll tell you you just fill it out, takes a couple of minutes, and it'll tell you exactly whether your benefits are going to continue. So, okay, and because I typed that in, all of the questions got jumbled up here. So I'm going to be skipping people, and we're running out of time anyway. We've got a lot of questions. So I'm just going to jump down here and get to people I've never seen before, people that are new to the channel. So I apologize if I'm skipping over your question. I apologize. I'll be back again tomorrow. Cut and paste your question, and then when I start tomorrow, immediately put it up there, and I'll answer it. Let me see here. DD-214 work if the military spouse deceased or for survivor benefits. Yes, yes. Make sure that if your deceased spouse never filed for benefits, you can send the DD-214 and make sure that's included in the record. John S. When I got SSDI, I didn't see a CDR time schedule on the ward or approval letter. Yeah, you can just call them up and they'll be able to look in the system and tell you what a disability review will be for. Let's see here. Is my DIC payment, you mean possibly the disabled adult child DAC payment from the VA countable? From the VA countable towards IRMA. IRS said is not included on line 9, Maggie. Usually not. VA benefits are usually not included in an IRMA type thing, but I can't give you a definitive answer on that particular benefit. Yeah, it's not counted on line 11 of your tax returns, but then they also count other things, overseas income. But I don't think that is. If it's not counted in line 11, I don't think there's a separate, the modified part. I don't think that is included in the modified part. Let's see here. Hoosier Dome, 67 and still employed. We are on strike. My medical will stop at the end of the September until the strike is over. I can go without medical or buy Cobra until the strike is over. Does this cause with me? Yeah, if you do not have health insurance from work for that time, once you stop receiving health insurance from work, you have 8 months to sign up for Part B without any penalties. So that 8 months, you can kind of play with and see if the strike is over. Yeah, at that time. But if it's longer than 8 months and you don't sign up, then you're going to have it penalized. What's the maximum amount of retirement Social Security benefits I can receive and still be eligible for Medicaid? That is a good question, and that's based on your particular state. Every state is different. Some states count Social Security. I've had people that are receiving, $2,000 from Social Security in one state. They got Medicaid because the state didn't count it. They moved to another state and that state counted it and they were denied Medicaid. So it really depends on your particular state. It's because the Advantage plans are fooling people on the extra stuff. Nothing is free. Yeah. Yes, exactly. It's actually illegal for insurance agents and brokers can lose their license if they say, hey, this Medicare Advantage plan is free, because it's not free. It's zero premium. The premium is zero, the premium, but you have to pay for, your specialists and maybe your doctors and hospital stays and your drugs. So it's not free. So you can't say this Medicare Advantage plan is free. If you ever hear a Medicare insurance agent say that, then they're not doing their job. They're iffy. Yeah. Natasha, only scenario not listed on Social Security site that I know of. Is there no Social Security support for a younger disabled widow with small child whose earned Social Security income is more than deceased? Can I collect both at 55? For a younger disabled widow, yeah, if it's called the Disabled Widows Benefits. If you're disabled, a widow, you can get disabled widow benefits from 50 to 60 years old. And for a younger with a small child. So if that child is the child of the deceased parent, then that child is also eligible for what's called surviving benefits. And if you're staying home, if you're not approved for disability, then you could actually get surviving child in care because you're staying home to take care of that child. So you can get benefits on the deceased person's record as well. So, all right, like I said, I'm jumping around a little bit. I'm trying to find people that I've never seen here before. Can you collect on your ex-spouse when he passes away if he didn't make 2 more times than me? So you're talking about if your ex is still alive. If your ex is still alive, then that's the 2 times. But if a surviving spouse is up to 100%, if your deceased spouse made $1 more than you, then you can collect that $1 more. So it doesn't have to be 2 times. It just has to be more than you. I made more. I'm 62 and on SSDI since 2012. We were married 20 years and he's 8 years older and I'm on SSI. You're on SSI or SSDI? But anyway, doesn't matter. Yes, if that person's benefit amount is $1 more than you, then you can collect. So I would definitely call up and find out how much that benefit. And remember, here's a lot of people are missing money. They think because I'm receiving disability, if I go ahead and start survivor benefits, my disability is going to stop. Sure, I'll make more money in survivor, but my disability will stop. And because my disability stops, my Medicare will stop. That's 100% incorrect. You can get disability, and because you're on disability, continue your Medicare and get spouse benefits and get surviving spouse benefits and get divorced spouse benefits. One offsets the other. If you're receiving $600 from, disability, and then you're entitled to $1,000 from some other record, you'll continue to get your $600 plus the other $400. So you won't get, both. You'll get yours full minus the other one. So, all right, let's see here. Penelope, hey, what's up, Penelope? Kansas girl, I don't think I've seen you here before. Is there any way to opt out of paying any more Social Security money while working on Social Security? I've been trying to do that at the IRS for decades. I've been trying to cancel my subscription to the IRS for decades, and yeah, no. Some people, start an LLC so they can take distributions and pay less into FICA and stuff like that, but again, based on the hundreds of thousands of retirement claims I've taken, 99.9% of the people regret doing that because their Social Security check turns into pretty much nothing when they retire. They got a boat when they were in their 40s, and that boat is since gone, and now they have to live the rest of their life on $900 a month. So, are you on Medicare right now? No, I am not 65 yet. I know I look 80, but I am not even close. Let's see here. New questions here. David, if you're receiving disability insurance for blindness, when can you sign up for Medicare? Yeah, if you're receiving any type of disability, your Medicare starts automatically 24 months after you're on disability. Peggy, after listening to you, I told my neighbor to watch for the changes on Advantage plans. Didn't read it myself, but she told me this morning with her plan, her meds benefits were cut over half. Yes, that's a big one. There's the new thing this year, the max you can pay for drugs is $8,000. Next year it goes to $2,000. So Medicare insurance companies are trying to make up for that. Pharmaceutical companies are trying to make up for the fact that the government can now negotiate. So, they're trying every way to get as much money as they possibly can. Since I'm getting widow's benefits, do I have access to his work records to make sure they are okay? Yes. Sometimes they kind of give you a hard time if they don't know, but yeah, if you were married to that person and you're getting benefits on your record, on that person's record, then you can request it. And if they say no for whatever reason, say, okay, I want a formal decision of why you're telling me no. Because sometimes it's just the person at the front window that just, doesn't know if they can give it to you or not. And so their default is no. And you say, well, thank you for your opinion, but yeah. My wife and I are both retired military drawing a pension. I'm drawing Social Security now, and she will be drawing November 2025. Will she be able to draw her full Social Security? Yeah. If she's her full retirement age at that time, she'll get her full Social Security benefits. And if your benefit amount is twice that amount, she will get some money on your benefit amount, your full benefit amount. So, all right, this will be the last questions. We've run out of time. Is a 401 distributions considered income by Social Security and counted against the threshold? The annual earnings limit threshold? No, it is not. That is not even counted in there at all. So, all right, that'll do it for today. Thank you, everybody. Please make sure you take care of those around you. Share this information. There's a lot of people out there that need help. Again, I apologize if I didn't get to your question today. Please join me again tomorrow. I will be back again tomorrow, 3 o'clock West Coast time, 6 o'clock East Coast time.